The sure way to help heal our society is through the treatment of psychological disorders that plague many Americans in the United States today, especially due to the pandemic. Hello, my name is Tabitha Mays, and I'll be talking about intermittent theta burst stimulation for the treatment of depression and post-traumatic stress disorder, along with other stress-related psychological disorders. In our day and age, so many factors have contributed to the over 1.5 million new cases of depression, with 12% of Hawaiians having depression, and 1 in 11 people suffer post-traumatic stress disorder or PTSD, which is most commonly caused from combat, sexual abuse, and serious illnesses like COVID-19, which has affected Hawaii with 166 new cases of COVID on average every day. So my credibility. I have had my fair share of depression and depressive episodes. Along with this, I do live with loved ones who have suffered PTSD and depression from things like combat. Now, these disorders have been worsened for many due to isolation of the pandemic and the inherent cautiousness and mistrust caused by quarantining. A preview of what I'm going to be talking about is what is intermittent theta burst stimulation? How does iTBS work to help treat depression and PTSD? And what does the success of iTBS mean for society? So, first off, what is intermittent theta burst stimulation? So, this is a form of therapy used for the treatment of depression and stress related disorders through transcranial magnetic stimulation that helps to replicate the brain's natural rhythm. They target the area of the brain responsible for the creation of those depressive feelings and PTSD triggers. Now, what does depression and PTSD look like? For depression, a person will have little to no interest. Their sleep schedule will change. They have extremely low self-esteem, which can lead to suicidal thoughts and tendencies, and extreme continuous sadness. While for people suffering PTSD, they'll start to gain more defensiveness and aggression. They'll have anxiety and aversions to loud noises and crowd sensitivity, along with suicidal thoughts and depression. So, how many people suffer from PTSD? According to the Department of Veterans Affairs and an article titled PTSD Treatment for Veterans, What's Working, What's New, and What's Next by Miriam Raisman, a prominent healthcare provider, 1 in 2 Native Hawaiians who served in Vietnam suffer from PTSD, while 1 in 7 Japanese Americans in Hawaii who served in Vietnam suffer from PTSD, and 30% of veterans from the Middle East or who have served in the Middle East, like Afghanistan and Iraq, also suffer from PTSD. So why did I decide to choose this topic? Well, for me, I wanted to adventure and look into more tolerable forms of therapy. Now, this therapy is administered at lower intensities and shorter intervals than normal theta burst stimulation. This helps to reduce the patient's discomfort and decrease the rate of certain traits without compromising clinical effectiveness. Now, I've always wanted to try and find the best forms of treatment and therapy for them so I can ensure a happy way of life for myself and for those suffering PTSD and depression as well. This is less invasive and has found results to show that this treatment can help lower the risk of outbursts of anger, anxiety, and depression. Secondly, how does iTBS work to help treat depression and PTSD? While it is easy to learn what a particular kind of treatment is, it is hard to understand how it could benefit someone without knowing how it fully works. So iTBS, more specifically, is a magnetic pulse directed towards, in most cases, the dorsolateral prefrontal cortex, posterior cingulate cortex, anterior cingulate cortex, and precuneus. Now, the dorsolateral prefrontal cortex, or DLPC, is the region of the prefrontal lobe which controls executive functions like memory and attention, while posterior cingulate cortex, or PCC, is behind the anterior cingulate cortex, ACC, and controls pain, memory, and retrieval. Now, the precuneus is the upper part of the optical lobe, and this helps to control perception of environment, cue reactivity, and memory and pain response. Finally, the anterior cingulate cortex, or ACC, which is in front of the PCC, helps to control emotional expression, attention allocation, and mood regulation. Now, the pulses help to train the often overstimulated neurons in the brain, causing depression and PTSD, to not react or to process the incoming information differently. Now, it is found that 76% of participants have found improvement in depressive symptoms. Now, the study, according to the article RTMS of the dorsomedial prefrontal cortex for major depression by Nathan Baker, and intermittent theta burst stimulation over the dorsomedial prefrontal cortex modulates resting state connectivity in depressive patients by Jorgen Persson, have found that the effect was observed in a region overlapping the precuneus and the posterior cingulate cortex, or PCC, which suggests an increase in the connectivity between the targeted salience network and the default mode network, mediating improvement in depressive symptoms. All in all, that means that this treatment has found that there has been a connection between the neurons in the brain and how a person processes the emotional, mental, and physical cues around them to help lessen the depression and PTSD effects. So, a quote from Lindwando, who published a study on intermittent theta burst stimulation and the response to stress in patients, says connectivity between the left dorsolateral prefrontal cortex, or DLPFC, and anterior cingulate cortex, or ACC, subregions could predict the degree to which the stress system is affected by intermittent theta burst stimulation. So through iTBS, they have found a way to determine how much of the iTBS a person needs, and have found that even in small spurts of magnetic pulses, a person can already start seeing the effects of the therapy. Now, what does the success of iTBS mean for society? For those who are suffering, you'll definitely be able to feel a whole change in your mood and the perception around you, and helps to regulate your emotions and your response to the cues and emotional triggers. And for those of you who know someone suffering from these kind of disorders, it helps you to see someone improve and helps to set them on the road to recovering from such depressive and oppressive disorders and help to change their lives around. So some hard facts about this. Now, after therapy sessions, a person is able to better become integrated into society and work with others without having anxiety or panic attacks. They're able to work in a variety of fields which can help the economy. However, just therapy and medication for PTSD have found that the success rates is only 20 to 30%, while therapy and medication success rates for depression is 50 to 54%. Now, with the addition of iTBS, we will definitely be able to add or make the rate of success so much higher. And according to a journal written by Walter Alexander titled Pharmacotherapy for Post-Traumatic Stress Disorder in Combat Veterans, and The Drugs Do Work by Sarah Bosley, and The Effectiveness of Long-Term Psychoanalytic Therapy, published by Harvard, have found that through iTBS and with the use of medication and other therapy, the numbers for PTSD and depression rates for success will definitely improve. Now, this method for therapy is so effective that experts have suggested that iTBS might reduce anger in veterans with PTSD. Now, this relates to the workplace because between 60 to 80% of work accidents are caused by work-related stress, like anger, anxiety, depression, all of those and everything else that comes with it. Now, when you go to iTBS therapy for treatment of stress disorders, this helps to control and heal a person's emotions, thoughts, and feelings. And this causes better customer service and a better work environment for yourself, which means that people are able to have long-lasting careers and job security, which helps to avoid other depression and other sadness and anger-related situations, according to Noah Phillips, who wrote Theta Burst Transcranial Magnetic Stimulation for Post-Traumatic Stress Disorder, published in the American Journal of Psychiatry, found that the iTBS can definitely help with the veterans' aggression, which can make their work environment for themselves and for customers so much better because it lowers aggression, depression, and stress. So, this quote, won't have to suffer from memory loss, lack of concentration, and poor relationships, sleep, fear, anxiety, and etc., comes from the article titled Secondary Analysis and Effects of Theta Burst Transcranial Magnetic Stimulation. Helps to show that this helps to reduce anger, memory loss, concentration, and leads to veterans and sexual abuse survivors, or even those who have lived through COVID-19, to overcome their fears and obstacles in life and can return to jobs, helping them on the track of sustaining themselves, their family, and hoping to improve their life. In conclusion, I hope that you are able to take away something new about intermittent theta burst stimulation and its use for the treatment of depression and post-traumatic stress disorder. Once again, I talked about what is iTBS, how does iTBS work for the treatment of depression and PTSD, and what does the success of iTBS mean for society. This quote, in every community there is work to be done, in every nation there are wounds to heal, and in every heart there is power to do it, from Marianne Williamson, reminds me a lot about what I originally intended for this topic, which was to help heal people through a new, more or less invasive form of treatment while also being cost effective. So iTBS is a path that many could take in order to start the healing process for our society. Thank you. And these are some of my references. Thank you.